what specific things about our procedure makes the healing and results better? I think we have many different things. There are a lot of details in doing a hair transplant, and over the years we have been perfecting them. But if I want to put finger on one thing and identify that as what it makes our results totally different than what we did before 10 years ago, even 5 years ago, is the use of Mohebi implanter. Mohebi implanter is an implanter that we invented, and we can load the grafts, these follicles, hair follicular units basically, and load them and place them into the holes that we made without touching the sensitive part of the graft. So we're not, unlike the old method or in other places that they still use the forceps can kill the stem cells, and many of those hairs, they can never make it. So with Mohebi implanter, we load the grafts and place them, and not only it minimizes the trauma to the grafts, but also it allows us to go with much smaller sizes of incisions, because unlike the old method, we use the much smaller size incisions. We're talking about 0.5 millimeter incisions. And when the incisions are smaller, we can dense back grafts more. We can create the look of more fullness with one pass of hair transplant as opposed to multiple. And we have more control on direction and distribution of the hair. So what it does, the follicle goes inside Mohebi implanter. The sizes are small, but the implanter dilate them, leave the grafts and come out, and the grafts are being grabbed inside the tissue. And by doing that, we have full control on direction, distribution, and density of the transplanted hair.